and we don't want to use our homeowners, but we want to use health services. And theoretically, health services could be unlimited. So we have this dilemma of increasing access, and then if I also worked in the insurance side of the business. Insurance people say benefits drive utilization. So that's what we have. Benefits drive utilization, which increases cost, which makes premiums higher, and for the people who have to pay them, more unaffordable. And so we've been struggling with this dilemma for decades. In the 70s, we had major federal legislation. And I spent a lot of money in graduate school studying some failed federal initiatives. But let's go through them quickly, and I'm going to be describing massive legislation in little sound bites. But in the early 70s, we had the establishment of PSROs, Professional Standards Review Organization. And again, all of these initiatives are because, oh my gosh, we passed Medicare and Medicaid, and then it cost us so much more than we expected, and taxpayers are unhappy. We got to do something. Professional standards review organizations were largely, okay, the federal government's now paying for a lot of people to be in the hospital. Let's make sure they're supposed to be there. Okay, utilization review, concurrent review. The HMO Act of 1973 actually intended to nurture the development of those nonprofit staff and group models that aren't around much in this part of the country anymore, but instead led to a whole new type of health insurance company. Do you remember commercials from the 80s? US Healthcare and the Apple, and whatever one Dick Cavett was advertising, an Oxford Health Plan. Then right after that, we had huge, what was it called? National Health Planning Development Something Act of 1974. That was a remarkable piece of legislation because it totally countered the Hill-Burton legislation of 1946. Hill-Burton, basically, the war was over, and the mantra was, this is the United States of America. Let's build the biggest, best hospitals in the world, and we're going to have a beds per thousand population ratio of 4.5. That was the US goal. Less than 30 years later, the federal government is saying, essentially, oops, 4.5 beds per thousand, too many. An empty bed somewhere is a bed that can be filled that we might have to pay for. New plan. And not only are we going to have a new goal of below 4 beds per thousand, we're going to try to constrain capital to these hospitals. And when you think of the terminology from some of these eras, the hospital arms race and things like that, so that was to make sure hospitals didn't buy too many CAT scans and overbuild and so on. The most important question I have for you, does anyone remember what happened on October 1, 1983? No?
Oh, that was
sticking to the healthcare world. But they're all related.